Feet are, quite possibly, the most neglected sector of the musculoskeletal system. Though everywhere you look, they are constantly at work. Feet are complex, with 26 bones, 33 joints, and many ligaments and muscles. Though researchers struggle to obtain comprehensive and accurate data on foot motion, the main functional elements are well understood. Feet function in two primary but opposite states. One is adaptive. During pronation, the foot adapts to uneven terrain by loosening its structure and yielding to the shape of the surface. The subtalar joint unwinds with pronation, reconciling inherited rotation from the leg, allowing the foot to remain pointing in the trajectory of gait. The second state is propulsive. The foot must resupinate to become an efficiently rigid mechanical lever for push-off. Both of these states relate directly to the height of the main arch of the foot. A flattened arch with pronation gives adaptation, or a softening of the foot structure. A raised arch with supination gives the foot rigidity. Most people demonstrate too much pronation and flexibility, some in childhood and some as they age. This is what one would expect considering the combined effects of gravity, increasing body weight, sedentary living, and the hard, flat floors of modern life. The plantar ligaments become overstretched and slack. The muscles are either too weak or develop overuse conditions such as tendinitis. A foot with too much pronation must compensate for the lack of resupination in a number of different possible pathways. One thing all these pathways have in common, however, is that they all lead to deformity, pain, or both. So the question facing most healthcare providers when evaluating their patients' problem feet is, what is the best way to maintain normal arch height and restore the missing resupination, since normal function is the key to pain-free musculoskeletal health? Assuming the condition has not worsened to the point of requiring surgical correction, most providers look to a good functional biomechanical orthotic or arch support for therapeutic intervention. The many different kinds of orthotics and their conflicting claims of efficacy can be confusing. Moreover, many providers have not seen the expected results achieved for their patients. If one looks at the various strategies currently used for correcting the foot with orthotics, though, there are really only two types. The first type is by far the most common or mainstream device. It is based on the ideas that emerged from the professors at the California School of Podiatry in the 1970s, most notably Dr. Merton Root. Root proposed a model of foot correction known as subtalar neutral, evaluated with the foot in midair, even though the foot functions on the ground. The goal was to encourage any particular foot into this position on the ground by means of frontal plane wedges under the heel or the forefoot. Most custom casted foot orthotics today have minimal arch support and a variety of such wedges, the most common being the medial rear foot wedge or post. If you were to observe your flat-footed patient standing first on the floor and then on one of these typical Ruchian orthotics, you would notice no change to the patient's foot posture. The arch would be just as flat, and therefore the foot would function the same with too much pronation. This is because no matter what sort of tilt you might put under the heel or the forefoot, if the arch is collapsing, it will continue to collapse until it is directly supported. A collapsed arch causes the foot to function abnormally when the heel leaves the ground. This abnormal function creates stresses and strains to joints and connective tissue that ultimately cause some of the most common pains and deformities afflicting the foot, leg, and spine. Conditions such as plantar fasciitis, bunion, metatarsalgia, Morton's neuroma, arthritis of the great toe, knee and low back pain can all be traced to a collapsing arch of the foot. The second type of orthotic design employs mass position as its goal of correction, using an orthotic that delivers full support to the arch. The foot is cast in mass position on the floor, which captures the optimal amount of natural arch easily obtained by any particular foot. The orthotic is made to this exact shape, and the supportive shell is calibrated to customize the right amount of flexibility. This depends on a patient's weight, foot flexibility, and activity level. The goal is to allow enough flex for functional pronation and comfort, yet enough rigidity to maintain arch height for normal function. Recent research performed at Georgia State University and McMaster University has begun to confirm the superior biomechanical results predicted by mass theory, with more research currently underway. Soul Supports is the only medical orthotic lab that makes orthotics according to mass theory and design principles. Since 1992, we have been able to retrain thousands of healthcare practitioners in this new technology, since many care providers have been frustrated by the lack of long-lasting results with traditional orthotics. In order to meet the challenge of this higher level of care, Soul Supports has had to redefine what it means to create a truly custom device for each and every patient. We call it Custom to the Fourth Power, because we deliver a custom solution to the 4 critical areas affected by foot orthotics. 1. A custom posture correction for each foot to regain function. 2. A custom posture correction for each leg and the lower back. 3. A custom pressure distribution across the bottom of each foot to minimize hot spots and rubbing on the skin. 4. A custom calibrated amount of arch support that factors in body weight and activity levels. A certified Soul Supports provider has been trained in the special casting technique required for these unique orthotics. To find a certified provider in your area, or just find out more about Soul Supports, we invite you to visit us on the web at www.soulsupports.com.